Welcome back, all of our Heal Inside and Out listeners. I have some words to throw out there before we launch into our topic today. Think about Tamoxifen, Exemestane, Letrozole, Anastrozole. Guess what we're going to talk about?
Those are words that some people will just start to panic about. Mm-hmm. The fear just starts to increase when they hear those words, those medications, and I know where we're going with this today. And I'm just really looking forward to this conversation because it's been something that a lot of people have been asking me about, and myself being on one of these medications. So let's dive in.
Yeah, and I would agree with you. When you think about breast cancer, there's some types that are affected by hormones, and both you and I were diagnosed with the triple positive, which is estrogen and progesterone, which I happen to be like estrogen extra positive, progesterone extra positive, and then the HER2 positive.
Yep.
And what happens, and you know this better than I do because you're a nurse, but if you imagine the breast cancer cells have little receptors on them, mm-hmm. and I'm making little movements with my hands, which our listeners can't see, but and they attach to the estrogen and the progesterone, which helps them grow, right?
Right. And that's why it's such a aggressive form, because the mutation of them, and because they latch on, just multiplies and multiplies and multiplies.
And that's a scary thing.
And that is very scary. And just to give just a little bit more background, to our listeners, is when I got diagnosed, I had my MRI and I've had, my mammograms and whatnot. And then they did one right before I started my chemo. So it was a month span from the time I got diagnosed to the time I started my chemo. And the mutation doubled in size. So my tumor doubled in size.
Wow.
In 1 month.
Wow.
Yeah, that was pretty scary. That was very fearful. It was like, okay, let's do this now.
Okay, so I'm just going to do a quick shout out too, that we cannot ever underestimate the importance of regular mammograms.
Yes.
Getting checked, checking yourself, and never hesitating to go in if you feel something is off.
It doesn't matter what it is.
Yeah. So
I've always told my clients and my patients that it's better to be safe than sorry. And I even used that phrase even when I was an EMT riding for the local fire department in my town, when people are like, I'm so sorry I bothered you. Somebody might be more sick than me. And I'm like, rather be safe than sorry.
Yep. So Dina, the hormone therapy is then the treatment that stops those hormones from attaching to those cancer receptors, right?
Yes.
And because that therapy, I believe, correct me if I'm wrong or add to this piece, but I believe that it can reach cancer cells beyond just those in the breast, which is why it makes it highly recommended post-surgery and treatment for those of us that had the hormone positive cancer to actually take this hormone therapy treatment for 4 or 5 years after.
Right. And it all depends on the practitioner as well. I mean, you said 4 or 5 years. My practitioner is like 10 years.
Oh.
And that was something that was difficult to swallow, because I'm in my 7th year of being in remission, although it's 6 years on the medication.
Okay.
So, or the hormone blocker. So, technically I have another 4 years of this, which 4 more years, I do have side effects, and we're going to discuss them in a minute, because we both deal with a lot of side effects. And the side effects that we're going to talk about some people that might be listening might not have, breast cancer. They might be a caregiver to somebody who's going through it, or they're listening because they want to hear about it because they're afraid that maybe one day they might get it. But a lot of these signs and symptoms of the medication we're on is the same side effects or symptoms of menopause.
And this is what blows me away is
I know we were talking about this a little while ago.
Yeah, and how many women are there? That's my whole question. How many women are there? And you think about this topic is not, number one, talked about enough, and number two, there aren't enough experts about it out there. And
no.
So just as a woman with menopause, there are different things that you can research and find out how to treat.
Right.
Like, women taking hormone replacement therapies and that sort of thing.
Mm-hmm.
But in this situation that we're talking about with hormone positive breast cancer, you can't do those things to help you navigate those symptoms. Cancer throws you into menopause, right?
Mm-hmm.
And then you can't treat the symptoms in the ways that are known about, if you will.
Right. Because what's known is, taking hormones. It's the hormone replacement, like we said. And it's tough enough going through menopause. And if you're that age and then getting diagnosed with breast cancer or another type of cancer. And then I keep thinking about, people that are younger, let's say in their 30s, who, let's say, get HER2 triple positive. And now they're not nowhere near as menopause yet. And now they're thrown into it.
Mm-hmm. Dina, were you in
I was
perimenopause?
I was perimenopause.
Yeah, so was I.
Yep. And then this just was like, beep, you're over on the other side of the fence now.
Yep, exactly.
So we have to deal with the hot flashes, the night sweats. I call them night sweats because mine are at night. Mine are like wee hours in the morning, like 4:00 in the morning. The leg cramps, the restless leg syndrome thing that I got going on. It's like I'll lay on the couch with my hubby and it'd be like my legs keep moving, and he's like, "What is wrong with you?" I'm like, "It's the legs again, honey."
And do you find that like at night, especially with my restless leg, I have to tighten and loosen because it's almost like there's little Pac-Men in there that are driving me nuts, and I have to keep tightening them up.
To me, it's like this little electric impulse going, like tapping me. It's like
with
tapping
the sound as well. It's that irritating.
Yes. And then I don't know, Maggie, if you get this, but every so often I get my calves cramp up.
Oh my gosh, yes. Random. On a day where I feel like I had plenty of water, my electrolytes or whatever else, it'll just cramp up like there's no relief. I will say it just to add a side effect in there that fascinates me is this whole, and I know you share this one with me, but joint pain. And what's interesting is they, I don't know if it's widespread or not, but my medical team called it arthralgia. You can say it better than arthralgia.
Arthralgia, yep.
And when I'm on my third kind of hormone blocker because they've been just trying to switch to the one that's least impactful on my joints, because that is my worst symptom, my most intense symptom, I should say. And when I went in and was asking all of these questions, he's like, well, yeah, you have arthralgia.
Yeah.
And I'm like, okay, is that a fancy way to say arthritis? And he was like, yeah, it's joint pain. So my bones and my joints, especially when I get up in the middle of the night, this is okay, Dina, this is like, embarrassing to talk about, but it's like when I get up to go to the bathroom, I have to go into our guest bathroom so I can lower myself down with something on either side of me because I can't just plop down on the toilet like I used to be able
it hurts.
to. I don't have the strength.
Right.
And it
the
hurts.
strength of the muscles.
Yes.
The pain in the joints. On top of it, I originally was diagnosed before the cancer with osteoarthritis in my right knee. Now being on the Letrozole, now I have osteopenia. So, which can turn into osteoporosis. So the bones are starting to get weaker. And, you know, there's times if I'm going to go do something, like even get up on a step ladder, my brain is telling me, all right, you need to be very, very careful, because if your knee goes out and you fall and you break something, here we go. So now, breast cancer, in remission, osteoarthritis, osteopenia, could turn into osteoporosis. And every time I go walking, or like, I'm really watching where I step, what I climb, you know, if I want to get something underneath the kitchen cabinet, I got to put one knee down on the ground because I can't squat like a catcher, a baseball catcher. You know, there are yoga poses. We're going to talk about some alternative methods, but yoga is one of them. And there's certain poses I cannot do because of my.
I was just going to say, because of my knees, which I have always taken for granted. I was a swimmer, and I had bad knees and like when I was a senior in high school, because my stroke was breaststroke, which is like the frog kick, right? So I had rough knees then, and then it got better, and I never thought about it again. I can't even sit Indian style now for more than a minute.
Nope, neither can I.
I'm used to that. So now it kills me. And to your point, there's certain yoga moves I'm trying to do that I can't do anymore, which is, you know, it's devastating when you are used to certain activities, and it's not like we're 90, right?
Right.
So, but the way you talked about your osteopenia, it's like this is where fear comes in, right? With all of the joint and bone pain, my fear that I battle and try to what if it and replace it. I fear permanent damage. Because with the pain we have, how do you not imagine it always being there?
Yeah.
Because it's so loud.
It's so true. And I'm going to go into one symptom that's very, very taboo for a lot of women. And the bottom line is the vaginal dryness. And it is something that, you know, it happens during menopause. And like I said, if you're a younger woman who's thrown into menopause because of your breast cancer, now that whole concept of intercourse, it hurts, it's painful, it's dry, it's, you know, it's just like, don't come near me. And then the libido that we have is lower than it was. So now okay, let's add that to the mix of all this.
Yes, and
the joint pain, the muscle pain. No.
Well, and all of them have their own, like a whole set of emotions that go with them. Like you said, if someone is especially young, I mean, it's hard for us at our age, but if someone is young, I was just talking to a woman who's in her mid-30s, and she is dating, and she is beside herself because she doesn't, like you say, her libido's down. She doesn't want, it hurts. She doesn't want to have sex. And it's just, it's so hard. And like you said, it is more of a taboo discussion, but again, here it's real and raw. And that's one of the real and raw items.
Right. And the key to that is truly just being open-minded about it, being self-aware of it. Having the conversation. It's going to be a hard conversation with your significant other, but it's a conversation that needs to be it needs to get done,
Mhm. Yes.
without a doubt,
Agree. Communication
it's,
key.
yes, it's difficult.
If nothing
It's
else, it might not change, obviously, what is happening or what the situation is, but if nothing else, it helps you feel you're not sitting and spinning around stories you're telling yourself or worries or guilt or all the stuff with the other person. You're just having the conversation, and that will feel better.
right, right. And another one that truly happens during menopause, and like we said, now that we're, because of our breast cancer, is insomnia, is the sleep patterns that we have. And, when people say insomnia, that they're up for hours and hours and hours, but just even your sleep pattern of not waking up like 3 or 4 times in the night, whether you have to urinate or you got the leg cramps, or, you woke up, now it takes you an hour to go back to bed. It's those kinds of things. It's the uninterrupted sleep that throws everything else off.
Yeah, so that's a great segue into some alternative stuff, because I know
Yes.
you and I have some different things, and for insomnia itself, like there's whole bedtime routines that you can put in place, right? And
Yes.
for me, I thought bedroom because I know you like a dark room and your eye thing on and all of that.
Yep. I wear a mask now. I never thought I would ever, but I wear a mask. I don't keep my phone in my bedroom. The night light that's normally in there, I keep it there for my husband, because he gets up to go to the bathroom, and there's a little bit of light, but that's why I wear the eye mask, and it's got to be dark now. And I do some deep breathing before I go to bed. Sometimes I might go into the bedroom and journal for a little while and get my feelings out or what's ever going on. So yes, or I listen to my Calm app, like maybe a 5-minute meditation for sleep. The app Calm has specific topics that you could use.
Yeah.
One is for sleep.
And that's, so for me, it's Insight Timer. And I love the sleep, the sleep specific, either soundscapes or meditations or breath work on there. And I actually bought a pair of like a headband headset because my husband cannot hear anything or it will wake him up. So I used to listen to like water, ocean waves, and he would just I'd get the eyebrow and he'd be like, are you kidding me right now? So I wear my headband and I listen to those sounds, and it helps. It helps me sleep. And the breath work, to your point too. And I'm still working on the no device thing.
Yeah, it's a practice.
Yeah, it is.
I'm not, it's not always 100% with me. It's not every single night, but for the majority of the time it is, and I'm going to go back to the taboo one of vaginal dryness, is because there are a lot of natural suppositories, that we can use to rejuvenate the vaginal area.
Yep. There's some very reasonably priced, all natural ones, like you say.
Right. And, there's also, I've tried acupuncture. I know you have tried acupuncture. And I know there's one other thing that you take.
So specifically for my joint and bone pain and I take beet pills. And what is fascinating to me, beets are so good. It's anti-inflammatory, right? But they're so good. When I miss a couple days in a row, it's so obvious that I've missed it, and I can just take them and get right back on track. So my beet pills, I won't live without. I take beef liver pills. I won't eat the stuff, but I'll take it in pill form. And then I actually also, magnesium is another thing that I have to take every day for the leg cramps and the restless leg.
Right.
It helps.
Right.
It helps. So those are, there's plenty of alternatives, and obviously you have to find what works for you.
Right.
But try things, explore and practice, and just see which things help. Since we can't take the hormone replacement therapies because we're trying to block them. We've got to find other ways.
Right. And I can't stress enough that we are not recommending to take or not to take. The bottom line, it's always important to check in with your healthcare provider, but I would love our listeners to once again remember to advocate for themselves.
Yes. So important. So important. And as you're in those doctor appointments, making sure that you're asking your questions, they are answering your questions. That you're sure that you're getting the answer, not necessarily the answers you want, but that they've answered the question. And then if they're not the answers you want or that make sense to you, consider a second opinion, because ultimately the choice is yours, but make sure to consult those medical folks.
Yes.
And just as a parting phrase, which we all know healing truly is inside and out. So here is to your ongoing healing, everyone.
Thank you for joining us. We hope you found value in today's episode.
And remember to share your real and raw insights with us by going to healinsideandout.com, where you can also find additional information and resources.